Hey guys, how's it going? I'm Dr. Alvarez with Endobariatric.com, and today we're going to be doing a little interview, and a very special person, a former patient of mine, and this is Denise, and I want to share her story. We talked about this yesterday and today because her story is very inspiring, and I told her, Denise, we've got to sit down together. We've got to transmit this story because it will inspire a lot of patients, people that are looking into weight loss surgery, that are looking into a gastric sleeve, that are looking into, should I take the step? Will I look malnourished? Will I lose just too much weight? Am I a low BMI patient? What's my expectation on being a low BMI patient? And certain aspects that your day-to-day changes, what has changed after your surgery, what have you gained with surgery and stuff like that. So Denise, you want to introduce yourself, where you're from? What do you do?
Okay, so I'm Denise. I'm from Amarillo, Texas. I'm an emergency room nurse, mother of two, grandma of one. Just happy to be here with Dr. A. If I could recommend anybody, obviously I would recommend him. I'm here again because I brought my best friend back to have her sleeve done. And
she's also a nurse.
She's also an emergency room nurse,
Yeah,
yes.
Which is a big honor for us, two nurses from the States, that you guys do a lot of research before taking a step.
Absolutely.
And
it's a big honor for us to trust a doctor.
Well, thank
because
you.
we absolutely, we trust doctors all day long, but we also know who we wouldn't go to.
Correct.
You know what I mean?
Correct.
And we know who, we do our research, we know who we would go to, and that's exactly what I did. I was recommended by a friend to come to you, and I had other options, obviously, and I just really did my research, and I loved her outcome.
You had options back home.
I worked with some options back home.
There you go, yes.
And I just felt like I follow you on Instagram and Facebook and YouTube and everything, and I just saw such amazing transformations, and nobody has complications, and I didn't see that as much the States seemed to, for me anyways, the research that I had done had seemed like there's more complications. I haven't seen a single complication from you. So, and me personally have had an amazing experience, and that's why I brought Naja with me. So,
well, thank you. Thank you for the trust. And this is what we do every single day.
Every single day.
Several times a day, and this is what we focus on. So,
which you can tell, because I like that you only do this, and what you do a max of 5 a day.
That's
4 or
it.
5.
We top it off.
Yeah.
Yes.
And it's not like a herd of cattle or anything like that. It's absolutely like
personalized.
You take us from the hand, baby step the whole way, from the time we land in San Antonio or whatever, our driver comes to get us, and perfect experience. I would highly recommend it.
That's why we have time to do this.
Yes. See? Yes.
And
yes.
Talk and yes. So I really appreciate it again. Well, tell us a little bit about your story. Somebody looks at you right now. Me, because I've seen you before, but somebody looks at you right now. You look amazing. You look phenomenal.
Thank you.
And nobody would even think you had a weight issue.
Well, it's not that. Okay, so just so everybody watching this can understand, I didn't feel like I was ever fat. I just felt unhealthy. I felt like fluffy, wasn't comfortable in my own skin, and that might be hard for people to look at me and believe that, but I absolutely, I just wasn't feeling, I felt sluggish, I felt like, and I used to do CrossFit and all kinds of Orange Theory fitness, and so I never could just maintain a comfortable weight for myself, and I just was constantly working at it. And then me being an emergency room nurse, I just exhausted by the end of a 12-hour shift and whatever. And so I had heard about this, and I had worked with some bariatric surgeons in a particular setting and whatever, and so that's what got my mind going. And my friend had come to you, and then I just did research here, and I did research at other places or whatever, and I just kept going back to you, and honestly, it just your outcomes, and I didn't have to think twice about coming to you, and I would recommend everybody. And that's why I'm saying I am the perfect testament to, and I'd be happy to answer any questions or give any advice, or anybody can contact me if they have questions, and I just feel like it's absolutely, I would bring a million people to you.
Well, appreciate it. Thank you very much.
Yes.
Means a lot.
So mentally, physically.
So you had surgery how long ago?
So it was 14 months ago.
About 14 months. And how much have you lost?
Almost 50 pounds. So what?
50 pounds, which is great, because I want to, this is a parenthesis here, because I want to mention that for a lot of people in their mind, well, they ask themselves, how much will I lose in a month? Or how much will I lose? My 50 pounds for you is your goal.
That's my goal. Yeah, I'm at my goal, and it was slow. It wasn't like...
Correct. And that is what we call a low BMI patient, a patient that's barely getting into the category of obesity and saying, hello, hi, I'm a candidate, right? And it's not like you were 300 pounds or 400 pounds. It's not the case, even though it's the same technique.
Right.
It's just adjusted and personalized for your setting. And that is very important for patients to understand, that even though it's the same technique, well, it's a very personalized technique. It's like an Italian tailored suit. Yeah. It's just meant for you and made for you.
And you make every patient feel that way. And he absolutely will.
And that's where we get our slogan from. That's where we get changing lives one sleeve at a time. Absolutely. Because when I'm there with you, with the patient, it's just you and I. Just I'm crafting. Yes, I'm just focused on crafting that perfect stomach for you. Yes. So you unfortunately, well, you did fantastic, but unfortunately, you just barely missed our newest technique, which is the arthroscopic sleeve, which is pretty much tinier incisions, pretty much barely or not even visible. But you look spectacular. Thank you. And so 50 pounds, going back to the weight loss, 50 pounds for most patients, well, maybe a 300-pound patient or 400-pound patient, they'll probably lose 50 pounds in 1 month. Exactly. That's something we didn't want in your case. Right. And indeed, patients with a lower BMI will eventually, in a matter of 10, 12 months, lose the weight, as you did. But it goes down slower.
Absolutely.
But you will notice a lot more sizes.
Yes. My scrubs, I had to change the sizing a few times, because I just kept getting skinnier and skinnier, and people definitely notice, and I just feel like it was the best thing that I could have done for myself. It was life-changing. I would give my trust you 100 times over. I've already said that. I would bring my own mother to you. I truly mean that. And so it has just changed me mentally also, just how I feel about myself, how the energy levels that I have now versus when I was fluffier or whatever, it's just a whole different perspective, and just the way you feel in your clothes, your jeans, how your jeans look, and I don't know. That's always been big for me.
So now tell me a little bit about, well, I know you obviously were referred by somebody else that had been here with us. You saw the results. You looked into us. You're a nurse. You started researching, and which is great. You took the step, but what would you get? Why Mexico?
I know. So a lot of people had a concern, were very concerned that I was going to Mexico for this procedure, and I just, I honestly, I have never once felt unsafe here. I don't know. I just really loved that that's all you did, and at 5 surgeries a day. That's huge. I mean, because I know, like, surgical procedures that are just done, I mean, I worked with an orthopedic surgeon that would do like 7 hip replacements a day, and that's a lot. You know what I mean?
Yeah.
And I don't know that you can like
really,
that really focus and take your time and be meticulous with your work and stuff. And I knew that about you, and so Mexico wasn't a big deal to me. Like, I just felt like, and my friend had said also that it was just a super safe environment. Like, you guys absolutely take care of us and make sure that we feel safe and comfortable, and there's Roman that will go get us whatever we need.
Our concierge.
Yeah,
yes.
I mean, it's perfect. I mean, this is a spa. It's a spa weekend.
Yes.
It's
time for you.
Yeah.
And you're getting surgery, and you're getting great results.
Yes.
And
Mexico did not. I mean, I'm sure people that may be viewing this might, be scared, going to Mexico or whatever. But honestly, like I never once.
Message is, do your research, because there's from Mexico to Mexico.
Exactly.
So do your research.
Yes.
Just like in the States, there's good doctors and there's bad doctors. I mean, just do your research,
right.
And it'll turn out fine.
Yes.
Yes, definitely.
And like I said, I'd be happy to help answer any questions or whatever. My Instagram, NurseNiece76. If you ever have any questions, I'm your biggest fan, honestly.
Appreciate it.
Well, Naja too.
Yes.
But
thank you.
We are absolutely your biggest fans.
Well, thank you very much for sharing your story here with us. And again, means the world coming from 2 nurses.
Yes.
Coming down here, especially one that worked with bariatric surgeons or surgeon. And
surgeons.
And coming
and
down.
I had options. I absolutely had options.
And letting me craft your sleeve, which is a big honor.
Yes.
And also thank you for sharing your story here with because it's I mean I knew you had done amazing via Instagram, but yesterday day before yesterday I saw you. Oh my goodness!
Really?
Yes.
Thank
oh my
you.
goodness! I said we have to do something. Yes.
Thank
and that is what I wanted to transmit to other people looking into surgery. Should I? What can I expect?
Do it. Yeah. Life changing. You will feel so good.
Yes.
So good about yourself.
Yes.
Like, just in general.
Yeah.
God, I mean, I still work out. I can still do everything that I did prior to.
Well, again, thank you so much for being here with us.
My pleasure. Thank you.
And you're a very inspiring story.
Thank you.
Thank you, Denise.
All right.